Hi everybody, Dr. Olivia Joseph here, and I am going to talk to you about hormones, which is probably a topic I get the most questions on. And I've had people approach me and ask me to do specific videos on PCOS, fibroids, heavy bleeding, endometriosis, thyroid dysfunction, low testosterone. And the one thing I say over and over, whether I'm speaking to people that I'm working with, whether I'm speaking to other healthcare providers, is we have to get down to the very root cause of those hormonal imbalances. This is particularly true for men and women, but let me just speak to the women for a second. Because oftentimes when we go through puberty, we have PMS, right? We have heavy bleeding, menstrual cramps, bloating, headaches, unpleasant symptoms. And we're told to, oh, just take birth control. That will fix the problem. It doesn't fix the problem. You're taking synthetic hormones, which if you take them long enough can shut down your own natural hormone production. Not only that, if you have low hormones like low progesterone and you take a synthetic progesterone, later on when you go off that progesterone and try to get pregnant, you may have a difficult time getting pregnant or you may experience miscarriages. So the reason I'm telling you this is because hormonal imbalances don't go away on their own and don't fix themselves. So if you have issues when you're in your teens and we label that hormone issue as PMS, which is usually a magnesium deficiency or low progesterone, what we end up doing is those hormone imbalances follow us decade to decade to get to decade, but we always play the name it and blame it game, right? When we get to our 20s, we might call those issues PCOS, infertility, endometriosis, heavy bleeding, fibroids, PMDD. Also, due to a hormonal imbalance. So let me break those down. With PCOS, oftentimes it means you're testosterone dominant. This does not mean you have high testosterone. It could mean you have low progesterone. And when you're testosterone dominant and you have elevated blood sugar or poor glucose metabolism, sugar and testosterone mix together, create inflammation in your hormone system, and create these tiny little cysts all over your ovaries, making you anovulatory, having you skip periods. Another reason why a lot of people go on birth control or a combination of birth control and metformin. The issue is when you go off the birth control or off the metformin, the problems come back and they come back pretty quickly. It only takes a few months. So in the 20s, I see a lot of women coming to me with infertility, PCOS, endometriosis, or maybe they have PMS or PMDD that they have had for a decade, but they were told, take this, take that, or better yet, take an antidepressant. It's in your head. It's not hormonal. Your hormones are fine. Or we've already given you hormones. Now add this antidepressant. Antidepressants are being used a lot in perimenopausal and postmenopausal women for hot flashes. Why? Because around the 70s, we started giving women synthetic hormone replacement therapy, synthetic estrogen, or a combination of synthetic estrogen and progesterone. And what it led to was a spike in hormone-positive cancers. So now, many doctors are being advised to give their patients antidepressants for hot flashes instead of hormones because they've been linked to hormone-positive cancer. But if you get a good health history on somebody, you can see that their hormonal imbalances go back decades. So speaking of endometriosis, one thing with endometriosis is estrogen dominance. This is a big problem because it can increase your risk for hormone-positive cancer. So when you're estrogen dominant, it may mean your estrogen levels are too high, but that's not usually what you see. What you see is the estrogen to progesterone ratios are out of balance. Or you see that the amount of dangerous estrogens are too high. The problem is your body will store these dangerous estrogens away in fat and glandular tissue. So you can cut your calories, you can work out more, but you're not going to get rid of those fat cells until you properly detoxify the estrogen. You can accomplish that in a lot of ways. Eating high amounts of cruciferous vegetables because they contain something called indole-3 carbinol, which helps your body to detoxify excess estrogen out of fat and glandular tissue. You can take calcium D-glucarate, which is a natural supplement that binds to the excess estrogen that's floating around, because it's dangerous when it's unbound. Once you bind it, your body can properly eliminate and detoxify it. That's why exercise is shown to lower your incidence of hormone-positive cancer, because when you exercise and break down a fat cell, the estrogen is released into your bloodstream, which is where it is not dangerous. It is not dangerous in your blood. It is dangerous in fat and glandular tissue. So blood estrogen levels are not the best way to measure estrogen levels. You want to look at tissue estrogen levels or estrogen excretion, so you can look at things like saliva and urine. You'll not only get progesterone levels, estrogen levels, but you'll see the progesterone to estrogen ratios. And if you do the urine test, which is called a Dutch test, which you can order on your own, you don't even need a doctor to order that test, you can actually see how well your body is methylating, which is an important detox pathway. But why it's part of this test is because you can see how well your body's getting rid of all estrogens, including the dangerous estrogens that have been linked to hormone-positive cancer. So I cannot encourage you enough to get the right testing, and I'll tell you right now, blood testing is not the best way to look at these things. So let's talk a little bit about testosterone. It's a very sexy hormone in men and in women. Why? Because it builds muscle, burns fat, also helps your joints feel good, function, and helps with mobility, but your brain needs testosterone. When your testosterone levels are low, you can have brain fog. So I wouldn't jump to identifying and fixing low testosterone in males or in females. What I would prefer to look at is what is the root cause. So let's go up to the adrenal gland. Cortisol is a hormone. That is not bad. Today I was working with people and one lady said to me, "Isn't cortisol bad?" No, cortisol is very sexy too. Cortisol gives you energy, regulates your blood sugar, your blood pressure, and helps you deal with stress. Cortisol levels should be highest when you wake up, lowest when you go to bed. It goes down because at night you shouldn't be keeping blood sugar stable and dealing with stress. You should be sleeping. So elevated cortisol levels are bad. Low cortisol levels are bad, or some combination of abnormal cortisol levels are bad. And a very common pattern I see with cortisol is low daytime cortisol, high nighttime cortisol. This is a problem. This is a problem because you're going to be tired during the day and you're going to be wired at night. Around the afternoon time, you're going to be craving salt, caffeine, or sugar. So it's very important that we properly evaluate cortisol. You can do so through urine or you could do so through saliva, but it's important you do not mix your samples. You have to take separated samples at different times of day because cortisol should be highest when you wake up, lowest when you go to bed. Cortisol affects the absorption of thyroid hormone. So if all your thyroid hormones are normal, the first thing I would ask is, have you really had all your thyroid hormones checked? I'm talking about TSH, T3, which is your active thyroid hormone, free and total, T4, which is inactive, free and total, T3 uptake, which tells me if hormones are blocking your thyroid receptor sites, as well as reverse T3, which tells me if you are weight loss resistant. If you're weight loss resistant, no matter how much you cut your calories or exercise more, you are going to have a problem. I saw somebody else that I was consulting with earlier today, and she told me, "I tried HCG diet and never lost a pound. I tried paleo, never lost a pound. I did keto, I lost 10 pounds, and now I haven't been able to lose any weight since." And when we look in, we see there's some issues with low blood sugar, and she's on a very low carbohydrate diet, which is what keto is. So when you don't eat sugar, and your body needs sugar, guess where it's gonna go? It's gonna go after muscle tissue. So your body's then gonna secrete cortisol to break down muscle tissue to get some glycoprotein into your bloodstream. So this is where I understand the ketogenic diet in and out, the HCG diet in and out, the paleo diet in and out, Mediterranean diet, vegetarian, vegan, gluten-free, dairy-free, egg-free, lectin-free, nightshade-free. I understand all of these diets and the benefits to them. But if you're cutting your calories and if you're working out, if you feel terrible, if you're not seeing results, if you don't sleep and you have no energy during the day and you stop having periods, or you're having periods too frequently, or they're heavy, or they're clotty, or they're dark, these are all signs of a hormonal imbalance. So stop brushing it under the rug and blaming it as it's menopause, it's age, it's perimenopause, it's PMS, it's PCOS, it's endometriosis, it's fibroids, it's infertility, and let's get to the root cause. So back to root cause. Cortisol, which is an adrenal hormone, is secreted by the adrenal gland. So is DHEA, and so is pregnenolone. So DHEA is a precursor to estrogen and testosterone. Pregnenolone is a precursor to progesterone. So if you have low progesterone or low estrogen or low testosterone, why? Well, let's take it up a level to looking at DHEA and pregnenolone. And if those are low, we better take a closer look at cortisol, because once you understand that whole hormone pathway, as well as the methylation pathways, the detox pathways, gut health, liver health, then you can properly approach the hormone system. Then you have a roadmap to know exactly why. Somebody else I was consulting with had breakouts along their jawline. Those are hormone-related breakouts. So I see these things all day, every day. When I see that hormone-related breakout, I do want to look at testosterone levels, but I also want to look at progesterone levels, because you can be testosterone dominant if your progesterone is low. If you're taking too much progesterone, it can make you gain weight, cause breast tenderness, breast swelling, because we produce a lot of progesterone when we are pregnant. But if you take too much progesterone, you can actually drive testosterone down. So these hormones have to be in proper balance. Same is true for estrogen and progesterone. They have to be in a certain ratio with one another so you don't become estrogen dominant and increase your risk, not just for fibroids, endometriosis, heavy bleeding, but increase your risk for hormone positive cancer. Now, if your estrogen levels are low, this can lead to hormone-related migraine-type headaches. If your estrogen levels are low, it can affect your bone density. It can cause vaginal dryness, things of that nature. So no hormone is good and no hormone is bad. Cortisol isn't bad. Testosterone isn't bad. Testosterone also isn't the holy grail. What is important is having all of these hormones balanced, because when they're all balanced together, they can stay balanced. People say to me all the time, once their hormone levels come back balanced, do I have to take this for the rest of my life to keep it this way? No, your body isn't meant to take hormones forever and ever. Your body is meant to make hormones forever and ever, because the day you were born, even in utero, you had a pituitary gland on your brain, which is what is regulating your adrenal gland, what is regulating your thyroid and thyroid hormones, and it's also what's regulating your ovaries. But I want you to understand, your ovaries are not a lifelong process. The reason we have ovaries and the reason we have a uterus is to bear children. That is not a process that's meant to happen from birth to death. It turns on during puberty and it turns off during menopause. That's how the body is supposed to work. Mother Nature doesn't do anything wrong. So we don't have to have high estrogen and high progesterone levels in our 50s, 60s, and 70s. It's not meant to be that way. So why are we synthetically achieving that? By taking hormone replacement therapy to push our hormones into what they were when they were in our teens and 20s, because they were meant to be high during our childbearing years. If you take a man right now and run hormone levels on him, you're gonna see he has progesterone, you're gonna see he has estrogen. Well, how is that possible if he doesn't have a uterus or ovaries? Well, the reason that's possible is because your pituitary gland is what's regulating all of your hormones. So we have to make sure your hormones are in sync with one another. I see thyroid symptoms and thyroid issues coming from the adrenals all the time. I see hormonal imbalances coming from the adrenals all the time. And you got to be conscious of looking at those hormone systems with your detox system, with your gut, but also with your blood sugar, because when I see people with really low cortisol and really low blood sugar, usually those people have cut carbs out of their diet completely. They're over exercising, making the issue worse because they're depleting their hormones. They have no fuel in the tank and they're not seeing any results. And when I tell them they literally have to cut back to exercise that isn't blowing out their cortisol, and they have to start increasing a little bit more healthy carbohydrate intake like fruits or sweet potatoes, they're scared to do so. Although as soon as they start doing that, they start seeing results. There's no roadmap that's a one-size-fits-all approach. There's no diet that's a one-size-fits-all approach. I have seen so many people go on dietary protocols like keto and paleo and achieve awesome results. I've seen people do high-intensity interval training and achieve awesome results. Why? Because those people had healthy cortisol and healthy hormone levels. So when they did those great types of diets and exercise, they got great results. So I can't stress enough, if you are not getting great results, get tested. You can order your own Dutch testing. You do not need a doctor to order it for you. The only thing is it's really tricky to interpret. I really don't think you'd be able to figure out what it means on your own, but at least you can have access to the appropriate testing that you can take to an educated provider. And I've also asked somebody to have me do a video on how to interpret hormone testing. I'd be happy to do so. There's podcasts out there about how to interpret Dutch testing, but there's no one-size-fits-all approach to interpreting testing because testing has to be done on a certain day of your cycle, ideally between day 18 and 21. Testing done through saliva has different functional levels than through urine, which has very different functional levels than progesterone. So there is no one-size-fits-all approach, but I hope this information has helped you. Share it with your friends and family members that you know want this information or are struggling with hormonal concerns. You can always go back into my library of videos and watch videos more specific to adrenals only, thyroid only, or whatever topic interests you most. And you can always post in the comments what you'd like to see more videos on. We're always taking a poll and trying to produce content that you want and that you are asking for. So thank you so much for listening to me, for following me, for letting me change your health for the better, and for changing your hormonal health for the better. Because one thing I have to say is your hormones can either work for you or they can work against you. It's not in your head. You don't have to cut your calories more and spend more time at the gym. Yes, you need to eat healthy. Yes, you need to exercise, but you got to do the right type of exercise for what your hormones or what your body is telling you. It's not work harder, it's work smarter when it comes to hormones. You can get your body to be a fat burning machine, and when you're storing fat region specific, this is an indication of a hormonal imbalance. I see a lot of women with estrogen dominance storing fat in their arms. I saw a woman today who told me that she has a lot of fat in her neck. And I said, you don't have fat in your neck. I'm looking at your thyroid ultrasound and your thyroid antibodies. You have a swollen, inflamed thyroid with nodules on it. That's not fat in your neck. I have women all day, every day telling me belly fat, belly fat. Well, when you have belly fat, you've got to look at cortisol, you've got to look at inflammatory markers, and you've got to look at blood sugar. It's a must. So you have to approach this with knowing all the information, and that's what gives you your roadmap how to properly address these hormone imbalances. Thanks.